Cannabinoids have become a very hot topic in the treatment of epilepsy during recent years. And I think major aspects of our session will discuss that there are different components which are characteristic for the cannabis plant, so that different components do have other effects. Some may have unwanted effects, others may have beneficial effects as we want them to have. And so it is very important to differentiate between these components of the cannabis plant and to see which are of interest for treatment, which are maybe only pseudo treatments. For example, cannabinoids which are got over the counter and which have no real content as a medical product would have. And then that also the safety of these compounds differs a lot, so that there are some compounds which can make you high, like THC, which is the most well-known compound of the cannabis plant, whereas others don't have these effects or may even have wanted effects in terms of the psychiatry, like CBD, which is not only used in epileptology, but also in the treatment of psychosis. So there are lots of differentiations needed. And I think it's a very good approach so that we have medical questions asked also to scientific experts, so that we learn a little bit about the background of these different substances, about the potential use and the potential misuse also. The cannabinoids are a very fascinating aspect of treatment because they really address an endogenous mechanism which the brain has to stop overexcitation and hyperexcitability. And so it is very interesting to interfere with this particular type of protective mechanism in the brain. And I think we have to learn a lot more about specific dosing, about the best compounds to use. But the field is extremely interesting, and I'm very much optimistic that we can learn a lot more how to use it, and also more of how the brain uses the endocannabinoids to regulate its function.